So how do we treat congestive heart failure in somebody who's not had a heart attack?
So when somebody comes with congestive heart failure, my job or any cardiologist's job is to find out what is the reason for it. If the blood pressure is very high, we do an echocardiogram to see if the heart muscle is strong or not strong.
And that's an ultrasound type machine
Ultrasound,
test?
echo machine. Ultrasound is very simple. In 15 minutes, we get a lot of answers. We find out if the valve is working well or not.
It's a painless, state-of-the-art test that we do all the
Painless,
time.
yes,
right?
all the time, yes.
And that gives you valuable answers. And so the echocardiogram comes back and it's positive, that they have the efficiency of the heart is, let's say, 50%. What would you do?
So 50% would qualify to be what we call HFpEF, heart failure with preserved LV function. And treatment for that is, giving some diuretics, medication that takes some fluid out, telling them not to eat too much salt. And
So there's a dietary program,
the dietary program.
an
Then
exercise program, I presume.
Then we do an exercise stress test to see if there's any blocked artery causing this problem. If there's a valve problem, then we figure out it needs to be treated now, or can it wait 6 months, or 2 months, or 1 month, or whatever. So if there's mitral regurgitation, you got to fix it at some time, otherwise it keeps damaging the heart. But if you have aortic stenosis, the aortic valve gets tight. It's just like treating very high blood pressure.
So in essence, we have at your disposal a battery of non-invasive
Yes.
tests, or perhaps through this little catheter, but you have a battery of diagnostic tests that you can very precisely identify the exact nature of what's causing heart disease. And then once the exact location of your heart failure is identified, then you can enroll that patient into a program that, if it doesn't require a procedure, they can be on the road to health. And if it does require a small procedure, that can be done either
that
locally.
can all be done here locally,
Right.
yes.
And if it's a big valve replacement, that has to be done in Chapel Hill, but it will be done by the doctor that you see here, and will follow up with you here, correct?
Yeah. And even the mitral valve, where the only solution was to replace them, nowadays they have what we call mitral valve clip, where they go and put it's like a fish mouth, they put 2 clips and the regurgitation decreases. And UNC Chapel Hill can do all that for us. It's just amazing how much advancement has happened in the last.
And it's all outpatient procedures, right?
It's all
None
outpatient.
of it is done with an open surgery like it used to be done.